I am so excited. On today, I was inducted into the American Academy of Nursing, which is one of the most prestigious honors it is for nursing. It was based upon some of the work that I'm doing now in my research. I work with the homeless, and I developed a vaccination clinic, a nurse-managed vaccination clinic for the homeless, and we vaccinated thousands of homeless people against pneumonia, influenza, uh, diphtheria, tetanus, acellular pertussis, and just recently, in the last 2 months, we've started vaccinating them with the hepatitis A. In so doing, I've had to write for several grants. I've been training people not only locally in our community, but across the nation. I chaired the nomination committee, the vaccination committee, actually, for the National Black Nurses Association, where I was training other nurses on how to duplicate these efforts, because I know that by helping them stay healthy, it's helping us stay healthy and alive. So it's really critical, but people have to know how to work with this disparate population, because they also have lots of mental health issues. And in doing so, it's winning them and helping them to know that you're not there to exploit them, but that you're there to help them to become healthier, to take charge and take control of their lives. The Minority Fellowship Program was the impetus for my completion of my doctoral studies. And I think wherever we go, there should be a takeaway. And I remember so well when they flew us to Washington. It was my first trip to Washington. I was still in my doctoral program. And they had all of these, what I call giants in nursing at the time, minority nurses that I didn't even know existed. And they spoke to us and they shared their experiences. And one of the things that was said, and I have remembered it to this day, and it has held true: if you want to grow in your profession, you will need to go. And I have lived that. And once I received the opportunity to do a postdoc, I couldn't do the full one at the time. I was doing the 2 weeks at the University of Penn under Dr. Linda Akins. I realized how much I learned, how much I was able to develop. When I was offered an opportunity to actually develop other graduate nurse practitioner programs, I took it. It was gutsy, but I remembered what I learned in the Minority Fellowship Program. If you want to grow, you have to go. And from that point in my life, from that start, helping to not only give me guidance, but also to support my cost of my education, I have never looked back. And look at me today. I'm here at a place that I never realized that I could be. But by being willing to go to grow, I have now come in contact with some of the greatest mentors I think that nursing has to offer. And it's all because of my start with the Minority Fellowship Program. I can't say thank you enough for it.